Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification, that is classification number 20, Hematinics and Hypolipidemic Drugs. This classification is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 19 classifications. So if anybody has not seen previous videos, go in the channel's playlist and watch all the previous videos, because this classification is very important for your GPAT Niper DI Pharmacist exam, and lot of MCQs they are going to be covered from these classification videos. So they are important, and please go and watch all the previous classification videos. My dear students, we will see classification of Hematonics. What do you mean by Hematonics first? So the term Hematonics means what? These are the drugs, these are the compounds, these are the agents which will increase the blood formation, which will increase the formation of RBC, which will increase the formation of hemoglobin, which ultimately increase the oxygen carrying capacity of your blood. So they are known as the hematinics. So hematinics are the drugs which are used to increase the blood formation or RBC formation or hemoglobin formation, and they are used in the treatment of anemia. Now these hematinics compounds, they are of different types. Basically these hematinics are classified into three groups. So first one is nothing but the iron preparations, then maturation factors, and last one is adjuvant hematinics. Iron is very important. So it is an inorganic iron or ferrous. Remember, ferrous, that is Fe2 plus, is only the form of iron which is absorbed from your stomach, not a ferric form, not a Fe triple plus. So ferric form or Fe triple plus form, that is a form of iron present in the inorganic. So whatever iron is there from inorganic source, so they are from ferric, and that is not absorbed from the stomach. So only ferrous form is absorbed from the GIT. Now iron is very important for the formation of hemoglobin, because hemoglobin molecule consists of a heme, that is a iron complex pigment, and iron is required for the formation of heme. Now iron may be either given by oral route, so oral iron preparation, or it may be given by parenteral routes, that is a parenteral iron preparation or injectable iron preparation. Now what are the oral iron preparations? So in that you have ferrous sulfate, in that you have ferrous fumarate, ferrous gluconate, ferrous succinate, ferrous ammonate, ferrous ammonium citrate, then ferric hydroxy polymaltose, carbonyl iron calcium complex. So all these are nothing but the iron preparation which are given by oral route. So they are indicated in case of anemia. There are different types of anemia that is beyond the scope of today's session. We have already seen types of anemia somewhere else. Now what are the iron preparation given by injectable route? Iron dextran, iron sorbitol, citric acid complex, ferrous sucrose, ferric carboxy maltose. So these are the iron preparation or iron injection or ferrous injections. There are certain factors or vitamins which are important for maturation of RBC. ये जो vitamins होते हैं वो ज़्यादा important होते हैं maturation के लिए. So in that you have vitamin B12 known as the cyanocobalamin. It is a water soluble vitamin, and it consists of cobalt atom and cyanide group. So it has a different vitamers. Vitamers means what? जैसे ऑर्गेनिक कंपाउंड के लिए आपका आइसोमर्स होता है, विटामिन के अगर डिफरेंट फॉर्म्स है तो उनको बोलेंगे विटामर्स. विटामिन B12 is known as cyanocobalamin. In this cyanocobalamin, cyanide group is there and cobalt atom is there. Now hydroxycobalamin is a hydroxy derivative of cyanocobalamin. Then methylcobalamin is a active form of vitamin B12, or it is also known as a mecobalamin. Now these are very important for the formation of RBC, right? Now folic acid, it is known as vitamin B9. It is another water soluble vitamin. It was first isolated from the spinach. ये spinach जो होता है आपका वहाँ से isolate किया जाता है, and that's why it is known as a folic acid. Now it is very important. ये after the absorption of folic acid is converted into dihydrofolic acid, then tetrahydrofolic acid, and tetrahydrofolic acid is very important as a intermediate for the transfer of one carbon reactions in the human body. Now folic acid, okay. Next one is a folinic acid. It is not a folic acid, it's a folinic acid, and it is known as a leucovorin citrovorum factor. This folinic acid is having important role in the growth promotion, and its role was demonstrated on one microorganism, or its role was studied on the microorganism, that is a leucovorin citrovorum. So that's why it is known as a leucovorin citrovorum factor. These are important vitamins for maturation of RBC, so they are known as a maturation factor. Now adjuvant hematinics. So copper is required in the very less amount. Pyridoxine is nothing but another water soluble vitamin known as vitamin B6, and riboflavin is another water soluble vitamin known as vitamin B2. So these are the hematinics. They are classified into these type. Okay. Now we'll see the important points from iron. So hematinics, they are nothing but the chemicals required to form the blood. They are used in the anemia. Example, iron is there, vitamin B12, folic acid, and hematopoietic growth factors. They are required for the formation of blood. That's why they are hematinics. And they increases the blood formation or RBC formation. They increases the oxygen carrying capacity of your blood. In the small amount, copper and pyridoxine is also required for formation of RBC. Now iron is nothing but the very important component of your hemoglobin molecule. In the hemoglobin molecule you have heme units. In the heme units, the heme units are nothing but the iron containing complex pigment, that is a heme, and it is a very important component of hemoglobin because it carries the oxygen. Now iron is very important for erythropoiesis. What is erythropoiesis? The formation of RBC. Now formation of RBC is affected in your body upon the response. जब आपके बॉडी में RBC कम हो जाता है, when your body has a decreased RBC, when your body has a decreased oxygen carrying capacity, so your kidney will produce one hormone known as erythropoietin. Erythropoietin is a hormone responsible for the increase in the RBC count or formation of RBC, that is erythropoiesis. Question already इसके ऊपर आ चुका है. This stimulation, that is hypoxia or anemia or a high altitude, that is a stimulus for the erythropoietin from kidney. Now erythropoietin will increase the formation of RBC. Now for the RBC formation you require three factors, that is iron, then vitamin B12, folic acid. These three are required for the formation of RBC. Iron is required for the formation of hemoglobin because vitamin B12 and folic acid known as maturation factor for RBC. Iron is required for formation of hemoglobin. Now hemoglobin is a metalloprotein which consists of 4 globin chain. ये यहाँ पे 4 globin chain होता है उसमें and 4 heme units बने. Now remember, one molecule of hemoglobin will carry 4 oxygen. One molecule of hemoglobin will carry 4 oxygen. इसके ऊपर क्वेश्चन आ चुका है. One molecule of hemoglobin will carry 4 oxygen. Now iron is present in the body in a different proteins. 66% of iron is present in the hemoglobin. 25% iron of your body is present in the ferritin and hemosiderin. 3% of iron is present in the myoglobin. Myoglobin is a iron containing protein found in the muscles. Now 6% iron is found in the cytochromes and other enzymes. Normally 0.5 to 1 mg of iron is daily required for males. For females it is 1 to 2 mg, and in the pregnancy it is increased 3 to 5 mg is daily required iron. Now what is the good source of iron? So iron source जो होता है, non-veg source जो होता है, that is a very good source of iron. So liver, egg yolk, meat, fish, chicken, spinach, then dry fruit, wheat, these are the sources of iron. Milk is a very poor source of iron. Now iron is absorbed from the GIT, from the stomach, and for the absorption of iron only ferrous form, Fe++, ferrous form is absorbed from the duodenum. Mostly inorganic iron जो होता है, inorganic iron, that is available in the ferric form, Fe++. So it must be reduced in the GIT. in the ferrous form to show that ferrous form will be absorbed. And for that, vitamin C is ascorbic acid, which is an antioxidant, which is a reducing agent. So it helps to reduce ferric into ferrous, and that ferrous is absorbed from the stomach, right? Now also amino acids, meat, and increased acidity means HCl will increase the iron absorption. Basic compound like phosphate, phytate, tetracyclines, they will decrease the iron absorption like antacids also. After the absorption of iron, iron will be bound to one protein known as a transferrin. Transferrin क्या है? It is a iron transport protein. इसके ऊपर भी क्वेश्चन आ चुका है. A glycoprotein which is responsible for the transportation or distribution of iron. Now iron is stored in the body in the form of ferritin or homosiderin in the liver, spleen and bone marrow. Or there is one more peptide known as a hepcidin. Hepcidin is a iron regulatory protein which decreases the iron absorption. क्वेश्चन इसके ऊपर भी आ सकता है, ठीक है. Normally 0.5 to 1 milligram of iron is excreted daily in the intestinal mucosal cells. Small amount of iron is excreted in the bile as well as desquamated skin and urine. Females में iron का loss ज़्यादा होता है due to menstruation, right? Iron poisoning is very important. Iron poisoning is commonly found in the children's. बच्चों में poisoning ज़्यादा होता है आयरन का. क्यों? क्योंकि जैसे प्रेग्नेंट वुमन को आयरन का डिफिशियंसी होता है, तो उसके लिए प्रिस्क्रिप्शन होता है, आयरन का टैबलेट प्रिस्क्राइब किया जाता है. सो बाय चांस बाय मिस्टेकन वहाँ पे जो बच्चे होते हैं वो आयरन का टैबलेट खा लेते हैं. द आयरन पॉइजनिंग इज वेरी कॉमन इन द चिल्ड्रन ड्यू टू एक्सीडेंटल इंटेक ऑफ आयरन. Normal a 1 to 2 gram of iron if that is taken by a children, so that children may suffer from iron poisoning. So what are the symptoms? Vomiting is there, abdominal pain, diarrhea, diarrhea with blood, that is a bloody diarrhea. Cyanosis means blueness of your skin. Acidosis, dehydration, cardiovascular collapse, coma and death after 6 to 12 hours. 1 to 2 gram of iron is a poisonous in nature and it can cause death in the children. Now what is the treatment? Gastric lavage. आपको पेट साफ करना पड़ेगा. Gastric lavage with sodium bicarbonate, and remember specific antidote for iron is desferoxamine. इसके ऊपर 2-3 बार क्वेश्चन आ चुका है. Desferoxamine. It was first isolated from Streptomyces pilosus bacteria. Now remember it is given by intramuscular route. Remember 1 milligram of desferoxamine will chelate 8.5 milligram of iron. So desferoxamine is known as a iron chelator or iron antidote, right? So 1 milligram of desferoxamine will chelate the 8.5 milligram of iron. इसके ऊपर भी क्वेश्चन आ चुका है. Now there are certain other chelators like EDTA, ethylene diamine tetraestic acid, and DTPA. But dicamerol is not used. It is contraindicated. Okay. Dicamerol means BAL, British amoebocyte leaves, British deferriprone and deferasirox. Deferriprone and deferasirox. These are the two orally active iron chelator used in the iron overload or in the chronic iron poisoning. Now folic acid is a vitamin which is isolated from first spinach and it consists of 3 parts: pyridine, PABA, that is paramonobutyric acid, and glutamic acid. ये 3 पार्ट होता है उसका: pyridine, PABA and glutamic acid. From the diet it is available in the form of polyglutamate. It is broken down in the intestine and absorption occurs in the jejunum, right? Now from the folic acid it gets reduced to the dihydropolic acid, then tetrahydropolic acid, and which is then methylated. Methylated tetrahydrofolate is active form and which is important in the 1 carbon atom transfer reaction. Deficiency of this folic acid results in the megaloblastic anemia and it is used to prevent the neural tube defect in the pregnancy. इसके ऊपर क्वेश्चन आ चुका है. Folic acid is nothing but the originally isolated from the liver, and the action or demonstration that it has a growth promoting effect was done on a leuconostoc cytoverum. That's why it is known as the leucovorin cytoverum factor. For male tetrahydrofolate acid is an active enzyme which prevent the toxicity, which is used to prevent the toxicity of methotrexate. Methotrexate is an anti-cancer drug which is known as a folic acid antagonist, and to prevent the toxicity of methotrexate, folinic acid is used. Remember, question answer. Vitamin B12, it is known as a Thomas Edison's anti-pernicious anemia factor और एक्सट्रिंसिक फैक्टर. बिकॉज थॉमस एडिसन ने क्या किया था, वो स्टडी कर रहा था एनीमिया के ऊपर, एंड ही फाउंड दैट देयर इज वन फैक्टर इन द स्टमक known as the intrinsic factor which is deficient in the pernicious anemia patient, and later on he was found that it is just a protein and the main factor is extrinsic factor. He named that factor that additions anti-pernicious anemia factor or vitamin B12. Now it is a cyanocobalamin produced by microorganism in the legumes of vegetable. A good source of vitamin B12 is meat, cheese, egg yolk, right? 1 to 3 microgram vitamin B12 is required for adult, 3 to 5 microgram is required for pregnant woman. Cyanocobalamin means cyano group plus cobalamin. Hydroxycobalamin is hydroxyl containing cobalamin. Aquacobalamin, nitrocobalamin means nitro group containing cobalamin. Then methylcobalamin and 5-deoxy cobalamin. Methylcobalamin and 5-deoxy is a active form, right? For the absorption of vitamin B12, you need an intrinsic factor. It is a glycoprotein present in your stomach. Transcobalamin is nothing but the vitamin B12 binding protein or transport protein. So vitamin B12 is transported in the body by binding with the transcobalamin second. Now it is used in megaloblastic anemia, vitamin B12 deficiency anemia due to deficient intake or impaired absorption or infection of the fish tapeworm. Right? These are the hematopoietic factors. Erythropoietin will stimulate the erythropoiesis, will stimulate the formation of RBC, right? Myeloid growth factors like granulocyte colony stimulating factor, GCSF, granulocyte colony stimulating factor. These are the factor which stimulate the granulocyte formation. Monocyte colony stimulating factor which will stimulate the monocyte formation. And GMCSF, granulocyte monocyte colony stimulating factor, which will stimulate both granulocyte as well as monocytes, right? So neutrophil, etc. Filgrastim is a modified drug which increases the neutrophil level, and it is used in the neutropenia, neutropenia and thrombocytopenia. Megalogramostin stimulate the granulocyte and monocyte macrophages. Filgrastim stimulate only neutrophils production, so it is used in the neutropenia as well as it is used in the neutropenia. Filgrastim is used in the neutropenia, decreased the neutrophil levels, right? Molgramostim is used in the decreased monocytes, granulocytes and macrophages. So thrombocytopenia. Now megakaryote growth factor. So they are nothing but the thrombopoietin increases the thrombocytes or platelets. Interleukin 2 which increases the interleukin. They are used in the thrombocytopenia, etc. after cancer treatment. Now what do you mean by hypolipidemic drugs? So these drugs which decreases the lipid level in the body, those drugs which decreases the lipids which are used in the treatment of different hypolipoproteinemia, or they are used in the treatment of coronary artery disease. They are known as a hyperlipidemic drug. So these drugs will decrease the lipid content of your body. See, lipid content of your body is present in the different form. So different lipoproteins present in your body. So पहला होता है chylomicrons, इसका size होता है 5 millimeter. So triglyceride content of chylomicron is a high 98%. Cholesterol is very low density lipoprotein, so it will have a high cholesterol level like 15. Now low density lipoprotein, it has a very high cholesterol level, and high density lipoprotein, it has a again less cholesterol. So the most dangerous lipoproteins in the body, low density lipoprotein, very low density lipoprotein and chylomicrons. These three are the known as a bad cholesterol. Very low density lipoprotein and chylomicrons, they are known as bad cholesterol. And increased risk of low density lipoprotein is related with the increased risk of atherosclerosis. You have to remember this, right? Increased lipoprotein or increased lipids in the body, that is known as a lipoproteinemia. Types of lipoproteinemia: type 1, type 1A, type 1, type 2A, type 2B, type 3, type 4 and type 5. These are the different types of lipoproteinemia or increased lipid content in the body. Now in the type 1 lipoproteinemia, chylomicrons are increased, that triglyceride level is increased, and cholesterol is nil. Okay, that's why it has no risk of atherosclerosis and does not require any treatment. Type 1 hyperlipidemia, type 1 hyperlipoproteinemia, type 2A hyperlipoproteinemia, that is the increase in the low density lipoprotein level. In that there is no triglyceride but there is a cholesterol, and that's why it has a highest risk of atherosclerosis, right? So statins are used as a first line drugs in the treatment of second A hypoproteinemia. Now type 2B hypoproteinemia. In that very low density lipoprotein and low density lipoprotein levels are increased, so it has a cholesterol as well as triglyceride, again related with the atherosclerosis. And in that statins, fibrates, nicotinic acid, these are the drugs used. We'll see what is statins, fibrate, nicotinic acid. टाइप 3 जो हाइपर लिपोप्रोटीनेमिया होता है उसमें इंटरमीडिएट डेंसिटी लिपोप्रोटीन एंड काइलोमाइक्रॉन्स बढ़ जाते हैं एंड उसमें ट्राइग्लिसराइड कोलेस्ट्रॉल दोनों होता है एंड इसके कारण एथेरोस्क्लेरोसिस का चांसेस भी होता है. फाइब्रेट्स आर द drugs. Now type 4 lipoproteinemia, in that very low density lipoproteins level is increased and will have only triglyceride increased, not a cholesterol, so no risk of atherosclerosis. So fibrates and nicotinic acid are used. 5 lipoproteinemia, so very low density lipoprotein and chylomicrons are increased, again no risk of atherosclerosis and does not require treatment. Now we will see different drugs in the treatment of lipoproteinemia. Hypolipidemic drugs or drugs used in the treatment of increased lipid levels. So hypolipidemic drugs. So they are classified into different types. So first class is nothing but the HMG CoA reductase inhibitor. HMG CoA reductase inhibitor. This is known as a hydroxyl methyl CoA reductase inhibitor. Hydroxyl methyl CoA reductase inhibitor. So what is the role of this HMG CoA enzyme? Hydroxyl methyl CoA enzyme is the enzyme responsible for the de novo synthesis of cholesterol. लिवर में कोलेस्ट्रॉल का सिंथेसिस करने के लिए एंजाइम लगता है hydroxymethyl CoA reductase. Synthesis, it increases the synthesis of cholesterol in the liver via mevalonate pathway. This is inhibited by these drugs known as statins: lovastatin, simvastatin, pravastatin, atorvastatin, rosuvastatin, and pravastatin. So these statins will inhibit irreversibly hydroxymethyl CoA reductase. क्वेश्चन ऑलरेडी इसके ऊपर एज इट इज आ चुके हैं. So HMG CoA reductase inhibitors. Statins are the HMG CoA reductase inhibitor. Now you have to remember most potent drug amongst the statin. So this drug is known as the most potent. Statin is the most potent drug in the HMG CoA reductase category. सबसे potent होता है ये. Okay. Also increases the high density lipoprotein. ये high density lipoprotein that is known as good cholesterol ये increase करता है. Then is simvastatin and lovastatin. Simvastatin and lovastatin, they are the prodrugs, and they are the prodrugs, and these three are the active metabolites. Okay, they are the active drugs. These two are the prodrugs. Now second class होता है इसमें bile acid sequestrator. Means these drugs they will inhibit the absorption of bile acids, absorption of lipids from the bile acid. So cholestyramine and cholestyramine. These drug binds with the bile acids and prevent their absorption. It blocks the transport of bile acids, active transport of bile acid. सोडियम टॉरोक्लेट, सोडियम बाइल एसिड जो होता है उसमें आपका लिपिड्स एंड होके एब्सॉर्प्शन हो जाता है, वो प्रिवेंट करने वाले ड्रग है कोलेस्ट्रामाइन एंड कोलेस्टिपॉल. सो दे आर द बाइल एसिड sequestrator. They will prevent the reabsorption of bile, active reabsorption of bile, and that's why bile along with the fatty acid will be removed in the feces. So they will have a diarrhea as an adverse effect. Another class is nothing but the lipoprotein lipase activator. Lipoprotein lipase activator. They are known as a GPAR alpha activator. So paroxysmal proliferator activated receptor alpha. Paroxysmal proliferator activated alpha receptor. So basically they increases the lipoprotein lipase. So lipoprotein lipase मतलब lipoprotein को break down करने वाला enzyme. All these are they are known as a fibric acid derivative or fibrates. In that you have clofibrate, gemfibrozil, benzofibrate, and fenofibrate. So out of that, fenofibrate is a prodrug. Fenofibrate is a prodrug Clofepidem is no more used. It is no more used because of the adverse effect. Gemfibrocil is a longer acting drug. You have to remember. So what will they do? They will increase the metabolism of lipoproteins, lipoprotein lipase. Okay. Now another category of hypolipidemic drugs is nothing but the triglyceride or triglyceride synthetase inhibitor or drug which causes the lipolysis in the adipose tissue. Example is the nicotinic acid जो है विटामिन B6 niacin इसको बोलते हैं niacin. So it increases the lipolysis in the adipose tissue. Adipose tissue में ये lipolysis करेगा, breakdown of lipid. Then another category of drug is known as a sterol absorption inhibitor. और ये जो drug है it will inhibit the inhibit the absorption of cholesterol. So that's why it is known as sterol absorption inhibitor. This drug will decrease the cholesterol level of your body and will increase they will decrease the low density lipoprotein, and all of these drugs will increase the high density lipoprotein. You can order this magic bullet for GPAT Niper DI Pharmacist exam. Preparation, read twice and qualify 100%. We have very much promising result, as you can see from the last 5 years. Thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 online crash course. You will have live lectures, recorded lectures, study material in the form of hard copy, online test series also. Everything is included in the 8,000 rupees only. And if you get GPAT rank below 20, if you get all India rank in the GPAT below 20, all fees will be returned to you in the form of reward. Thank you very much.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify